Okay, welcome back. You're listening to A Path to Wellness on rhinoanair.com, WSPF-DB.com. And I'm Dr. Christopher Jackson, PhD, DOM, Florida. And I'm here with Emily Stein, who is a PT, personal trainer, and also is involved in something called Yamana ball rolling.
Yeah.
Is that the right term?
It's called Yamana body rolling.
Body rolling. Yeah.
So I'm a personal trainer and I specialize in flexibility and mobility training. And I utilize Yamana body rolling and active isolated stretching to really enhance people's lives. And I work with people that have chronic pain, plantar fasciitis, arthritis, carpal tunnel syndrome, anyone that has an injury or that's looking to improve their flexibility. And people, as you get older, things don't always move as well. You get tight, you're exercising, and you need to stretch. People don't realize that the power of stretching is really important because as you get older and you're doing things, something happens or you fall or you get in an accident. So I use a mixture of balls with Yamana body rolling and then straps and stretches with active isolated stretching. One works with your bone stimulation and then the other is connective tissue dynamic stretching.
So I think we need to break that up a little more slowly here. Yeah. So, okay.
Yeah.
So let's start with half of that. Dynamic stretching.
Yeah.
Tell me what you're talking about there.
So dynamic stretching is assisted isolated stretching, where you're isolating the muscle and not holding it for more than 2 seconds. And each time you stretch the muscle, you get more range of motion.
Mm-hmm.
So think about if you're holding something for more than 2 seconds, you're going to aggravate the muscle. And that's why dynamic stretching is really important. And the really big thing is with it's actually called the MATS method, is that it's the only stretch and modality that really works on your connective tissue. So it's enabling you to really get the stretch reflex without aggravating the tissue. So I combine the balls with stretching, or I just do an entire session of active isolated stretching. So,
okay.
Yeah.
And then the other part that you were mentioning was?
I use, before I got into air and mats, I did my training with Yamana body rolling at the headquarters studio in New York City back in 2014. And that training I got into it because I've always liked yoga and was into dancing and exercise and wanted something that really made me feel better. And a family member was doing physical therapy and was getting no results. And not saying physical therapy doesn't work. It's just, it's good to do some type of exercise when you're done with physical therapy. So I did the training in New York. But before that, you have to do a class before you get certified. So I took one class for an hour and felt like I had a full body massage. And it's amazing what the benefits people feel. And you end up, you roll your hamstring and one leg is longer.
So here's the deal. The way you said that sounded to some, I'm sure, like you only got an hour of training. Let's clarify that.
Yeah. So no, I'm saying you're required for the training to do an hour class with a practitioner. And then I did a 2-week training in New York, and then 6 months later got certified by my teacher in Sarasota. Right. So I've been teaching this for about 2+ years, and I'm pretty much the only one in the Tampa area that teaches it.
It's excellent.
Yeah, and you can't purchase the balls or get the equipment unless you're a certified practitioner. So we've gone through extensive training, learning about anatomy and physiology, and we are kind of the new foam roller, because a lot of people are familiar with the foam roller, but the balls are much softer. They can be deflated. You can travel with them. They kind of conform to your body. That's why they're great to use they're multi-purpose. You can use the balls in bed. You can use them in a chair. You can use them on the floor. So they're multi-purpose.
Yeah. Can you use them to keep you from snoring at night? Like
you probably could. Yeah, you probably could. You probably could could lie on your bed and put the ball like in between your legs when you're lying on your side. Or there's actually a method called Yamana face ball, where it's good for people that have like sinus issues and probably for migraines, because you're working to kind of massage the face bones. Mm-hmm. So that's kind of how it works. So it's all modalities. Both active isolated stretching and the body rolling are good for keeping your body healthy. So
very good.
Yeah.
So what you said that part of what you got into this was, I think it was your dad, you said?
Actually, it was my mom got into it because she fell off her bike and hurt her shoulder.
Mhm.
And then later on, I kept telling my dad to stretch. And I was like, you should stretch. And then he got into it. He's a tennis player. And then I had a client of mine, and she was a runner, and she had severe knee pain, and her knee pain is gone. And I could count the number of people that have, someone has fibromyalgia, and her flares have gone down. Someone has arthritis, and her arthritis pain has gone away.
Mhm.
It's just a matter of having a couple sessions, learning how to use the balls, and getting into the routines.
Mhm.
It's really not complicated. You just have to take the time to learn it. You can use the balls while watching TV. Everyone lies around and home and just on the floor not doing anything. Just take a ball and I give you the exercises. I give you handouts so you know what you're doing, and I'll send you a video. Here's what we did. Because some people learn different ways.
Mhm.
So I always want to make sure people have the tools that they can do on their own at home.
Mhm. Yeah, sounds good.
Yeah.
So, all right. So I tried it a little bit with you,
Yeah.
right? And we stretched out my pecs.
Pecs, yeah.
And basically relaxed my
Mhm.
trapezius to
Yeah.
try and bring my shoulders
And your
back.
so-
a
and your
little bit,
psoas.
some of that.
Because a lot of
And
people have
psoas.
collapsed. Yeah, and a lot of people have collapsed lower areas. And our hips get really tight. Hips and shoulders are the biggest problem areas in your body. So when we're opening up and we're creating space and we're lengthening tissue, it helps to breathe better. So we're elongating the bone, and then you hold the stretch with AIS. So the combination is like gold. It's like you have a tool in your toolbox you can get out.
Mhm.
It's like all these other things out there. Like, I'm giving you something that's powerful and that can take care of your health. But yeah, when you work the pecs, it's really important is that when your chest is back and your chest is open
Mhm.
and you're not slouched over, you're not collapsed. So you think nice to they almost think like a string is pulling your head, and it's pulling your head up. And just like sit nice and tall with your nice and straight. Yeah.
Question
And you're
then,
breathing better.
Breathing better, yeah.
Doc, from a doctor's standpoint, from the other side, because on her portion of it is more hands-on
Mhm.
therapy
Exactly. Yeah.
to solve, to take what you know that's
Mhm.
going on and provide some of that movement.
Mhm.
From your standpoint, where does this come into play how do you,
Yeah. How do I
combine
differentiate?
this,
And-
and combine this with your,
Well, I do several kinds of therapies: laser therapy, electrical stimulation, acupuncture, different things to treat back disorders, all sorts of musculoskeletal issues.
so
And-
I'm so sorry. So I want to rephrase that. When do you
Mhm.
refer somebody? What is happening? What happens in order for you to send somebody, let's say like myself, to Emily?
So if they aren't responding to the point that I think they should be responding based on my experience, then I'll refer them over to Emily. And it can be any area, but I think primarily back, lower
Yeah,
back,
and lower back.
and
Yeah,
shoulders. like you
Shoulders and
Mhm.
hips. Plantar fasciitis is a big one. People that have a lot of
There you go.
which people have a carpal tunnel.
Mhm.
Yeah, everyone has from all the things and typing and all the texting we're doing, and all the neck stuff and phone usage, and we're all trying to break up patterns.
Yeah.
So I think he's great practice, and it works along the lines because when you're finished acupuncture, you can do rolling. Because it's a good thing when
Or
one's
even
in
in
conjunction.
conjunction, yes.
Yeah, conjunction.
Together.
Absolutely.
It's a great combination.
Yeah, because it works well to kind of open up. You're opening up with acupuncture, and that way the body's open.
Yeah.
So if someone's really tight, I will have them get a massage before seeing me. And I do work with some other massage therapists, and they're usually structural work. I say, hey, they work with them, and then they can come see me. Because I'd rather, some people are either really tight, and they need to get a massage before they come see me. So I do have the conditions that I really don't work with. Like, you can't really do stretching with bone cancer. And I think depending on the condition, like I'm not a medical professional.
What about MS?
Yeah, I could probably MS, Parkinson's, a lot of
Neuromuscular.
neuromuscular conditions.
Yeah.
There's some things that I'm getting more experience working with.
Mhm.
So I would say for the most part, general ailments.
Yeah.
See, and you just mentioned something, and I'm sorry, I always jump in because Doc always brings in these amazing guests as well that just, combine everything. When you just mentioned you would refer your patients to somebody else for a massage.
Yeah.
So I'm sorry, but your title is?
Well, my title, the reason I said refer is that if I ever needed to, which I usually don't because I think my work actually encompasses a lot of massage. I'm saying just in the situation
Okay.
that that was that person. But most of the time, if someone's good, they could come see me. I get massages just for myself with other people, and I trade.
Yeah.
I trade with, because a lot of massage therapists, they need to do work on their own. So I trade with other people in the field. But my background is just, I got my personal training certification, and I have qualifications to do what I'm doing. And a lot of people ask me, you're a massage therapist? I'm like, no, I don't have to be a massage therapist. But a lot of massage therapists, their careers aren't, they shorten because they can only work on so many bodies. That's why the balls are great and the stretching is great, because the person is doing half the work. The person they're working with can't just lie there. Unless they want to lie there and I'm just tractioning and using the ball, I can do that. I'm fine doing that. It's called a hands-on assist. But if they want to be proactive, then they're there and they're doing it and I'm showing them.
And that's the personal training aspect.
Yeah, the personal training aspect. You're guiding them. I'm guiding them through the process of how to make themselves better. Yeah.
Right.
Yeah. Just a different kind of personal trainer.
Yeah.
Taking them through a stretching session.
Yeah, and
I do some strengthening too with active isolated, because there's active isolated stretching and then there's active isolated strengthening. So there's two components of it. Yeah.
Stretching and strengthening. And you're also stimulating a lot of things there, like you're stimulating the sensory elements that are in your tissues and your skins.
The central nervous system. That's this what really encompasses a lot of the work is that we do work with the entire central nervous system. And we work with your bone and your fascia. So that's kind of what separates the work that I'm doing from a lot of the stuff out there, is that we get direct. It's deep work. This stuff is not always fun the first time. It can be really painful. Like you get a massage and you're really tight after. Like you could be really tight after doing this. But the more you do it, the easier it gets. And I've had someone's whole body change. Like my body has changed so much from doing this practice.
I have a question also. Is it myth or reality that if you have a cold, you're not feeling too good, or you have something going on and you go and you get this massage, you get some therapy, now all these toxins start releasing in your body. If you're not a person that drinks a lot of water, for example, can I get sicker?
No. I think it's just really important that with any kind of practice, it is detox. So I always recommend people to drink water before and water after, because you are releasing.
What I would have said there is yes, actually.
Yes, yeah.
You can get sicker because all the toxins are coming to the surface. You're spreading them around your body. And if you don't flush, like she's saying, with the water before and after, you're going to tend to build it up and it's just going to be sitting there. Yeah. And, there is kind of a lymphatic aspect to
there
this
is.
as well.
There's lymph. There's lymph.
Getting some lymph flowing.
Lymph flowing, especially for women that have had breast cancer, or just a lot of. I worked with a woman and she had breast reconstruction surgery, and I had a couple sessions with her, and she felt the relief from it, because it's just working with it's your tissue and your fascia, and we're getting things moving. It's like things get so tight, and we need to open. We want it to be open. We don't want it to be contracted. So.
Now you made an interesting statement. I caught a little piece that caught me off a little bit. You said you're stretching the bone.
Well,
Explain that to me.
stimulating. It's bone stimulation, which means that muscles are connected to tendon, are connected to bone.
Right.
So that's what we're doing. We're stimulating the bone, and we're stimulating your fascia and your tissue.
Okay.
That's
so it's not really stretching the bone.
No, it's more of just it's bone stimulation with the balls, and then you're able to stretch your fascia, and that's why it's called myofascial release.
Myofascial.
Yes, you're able to be. You're
which a lot of massage therapists do practice.
Yes, they do, and so
myofascial release.
Yeah, and so.
And you're applying pressure to the bones as well.
Yeah.
At the same time, right?
Yeah. Mm-hmm.
And applying pressure is part of how bones do grow and regenerate.
Mm-hmm.
It's called it's piezoelectric response. It's the stimulation of the crystals and the electrical impulses that then stimulate the bone to redeposit, basically, to regrow and to continue to be healthy. And that's one of the things we want to do with, here's something else for you, osteoporosis.
Absolutely. And it's a diagnosis that people get, and I think, I'm not saying it's made up, but I kind of think the medical industry has.
Oh, it's not made up at all.
I
Yeah, but there's
Yeah.
an aspect to it that a lot of it comes from treatment.
Yeah, and also diet and various.
Yeah.
So there's things with anything with your bone and osteoporosis and arthritis and rheumatoid arthritis, any muscular condition. It's really about keeping yourselves healthy and flexible.
Yeah.
And the more you work on stretching, the more you work on flexibility, the more things move along, and the more you have blood flow in the body, in those areas of the body, and the less likely you are to experience any of these other things.
Right.
When blood is flowing healthily in the body.
What about somebody that has, say, a fatty liver or has some liver obstruction?
I'd have to look into that. I'd have to look into.
So you have to be kind of careful of the upper abdominal
you'd have
right side.
Yeah, I could do some research into it. I don't know that much.
Or gallstones or things like that. You have to work around that.
Yeah, you just have to be cautious of.
And a lot of people do and don't even know it. That's the other aspect.
Yeah.
So there's a lot of interesting aspects to this. We're still beginning to explore.
Yeah, but this work has tremendous impacts on people that experience that are tight, that have just people that have low back pain. Everyone says they have it, or they have piriformis syndrome, or they have sciatica.
Yeah.
And there's some cases that are extreme that if they've never exercised at all, then it's going to be harder when they do it. But if people are already engaged in gentle yoga and gentle stretching, and they can move around, they're the perfect candidate for doing something like this.
That's good. So. Interesting. So, I kind of want to analyze how it's working.
Yeah.
So can you break it down a little further in terms of how it's changing things?
Well, it's changing your.
I might help you out a little bit.
Well, it's changing your lengthening your tissue, and as you lengthen, you're elongating. So if I had my ball out, a lot of it is just visual. Like if you took the ball and you rolled one hamstring, you can visually see if you do one hamstring, the one leg is longer than the other. So we're elongating the tissue and we're stretching and we're lengthening it. So the science behind it is in the joint. To be bone on bone. So the science behind it is that there's an article in the Journal of Physical Therapy which basically tells you why this is great for you, and it's been around for 25 plus years. There isn't really a ton of money that's going to go into a science studies bone with body rolling, unless some magical person says, "Yeah, I want to go do research on how bone density has changed," and bone density can change with this, which because I've seen.
I would assume so.
Yeah, absolutely. There's actually been someone in my field. Someone in my field made a comment. There was a group on Facebook, and they're talking about how people's bone density. They notice change in bone density.
Yeah. So the idea of osteoporosis is a really good thought. Yeah. So I'll be keeping that in mind too.
Yeah.
And one of the things, just getting to the etiology of all that, one of the real causes, I would say, or at least something that's influencing the development of osteoporosis, is how much Synthroid is being prescribed. Because Synthroid is stimulating, it's just a T4 synthetic, and that means that you're raising your metabolism without having all of the other components that go along with that.
Yeah.
And one of those is calcitonin that's produced by your thyroid.
Yeah.
And calcitonin downregulates the amount of calcium that you pull from your bones. So if you raise your metabolism but don't raise the calcitonin, then you're pulling more from your bones. And therefore, this is one of the results with Synthroid. A lot of people get osteoporosis. So it makes sense. And so another part to this, getting deeper, is looking at, well, are there other ways we can treat, aside from Synthroid, where they can get the complementary action of the calcitonin and so on, maybe with vitamin D and some other things too. And
I think that one thing I wanted to
combining those therapies.
Yeah. And I think there was just Andrew Rhio, who's an integrative medicine doctor out in Arizona. He just had a podcast on how reducing our pain, the prescription medications we take, and using alternative method approaches, and the fact that it's important that yoga and massage and acupuncture is included, and so can body rolling, so can stretching. It's just it's included. It's a form of exercise.
Yeah.
It's very low impact. All it requires is getting on a yoga mat and a ball and learning how to use it. And if you can't do that, you can go on a table and it can stretch you. So there's two options. But yeah, there's just articles coming out about people that they're just various medications people are taking that they don't need to take, and there's alternatives. I understand there's certain medications people have to take. That's fine. But if they're not necessary, if they're a pain medication or something, these people get addicted to them. And
actually, all the all the opiates and so on, especially. And the funny thing is, with acupuncture, you're stimulated to produce endogenous opiates. You know, produced by your own body. You don't need to take opiates. Your body can make them. And I'm making a mental leap here. That there's a likelihood that you're doing some of that same kind of stimulation because of the sensors that are stimulated when you're stretching the skin.
Absolutely. When you're stimulating, it's a sensory nervous system. That's why when I'm doing it, people often tell me, I feel all this warmth through my leg. Someone told me I was doing it, and they said, oh my God, I'm feeling a cramp. Like they had to stop, and I said, yes, it's fine. If you have to stop, it's fine. We can just start again. But they felt this warmth going down there and feeling they haven't felt before. I met with this lady. She's 70, and we were doing her shoulder, and she had no feeling in her arm. And we were using the ball against the wall, and she had to stay there because she started to get a feeling back into its blood flow. It's amazing what just using a ball in your own body weight can do. And I'm just still like, I think this stuff is gold.
Well, I think
just from
I can see that, and I tend to agree with you. And I think we got something special here. And I think the combination of what we do is a great thing, and you know, that's part of our vision together is to expand this and so on. In terms of other types of disorders that are somewhat similar, for example, diabetic peripheral neuropathy, I treat that with acupuncture, electrical stimulation. I definitely see extremely good results with that combination. But I bet we can enhance that even so. And the same with many of those kinds of disorders. Like you mentioned, plantar fasciitis is a very similar kind of thing.
And even people that have people that are diabetic, their feet get swollen. So that's also something that people have feet that get swollen. That's another, plantar fasciitis is the biggest problem. It's because the reason it happens is because there's no separation between the heel and the rest of the foot. The fascia is glued together. So when you break up the fascia, so I use these foot wakers, they're these little porcupine little mounds, and then I use these two little black balls, because when you work on the calves and the hips, you're opening up and creating that space. So the foot wakers aren't always fun to be on, but they're really good because they kind of create you think of like your foot, you have an outside line, you have an inside line and an inner line. And when you think about using the entire foot, you work on the lateral line of the foot. So I do like a walking test where I'm literally showing people how to walk. This is how you should walk. And then I observe from on the beach, I see people's footprints. I can tell which side of their foot that they're walking on. Yeah, it's interesting, people's feet. And I see people walking and their ankles are collapsing. And I want to help them. So it's just, some people are born away, and if someone's born away, that doesn't mean they have to be flat-footed. Just because they're born flat-footed doesn't mean that they have to be flat-footed. You could build the arch. So,
Very good. Very good. I like it. So, as you can see, there's a lot of possibilities, right?
The list goes, because I work with, majority of the people that I work with are either people that have chronic pain, women that are either they want to have a child or had a child, and then I feel like individuals that are looking to prevent injuries and enhance what they're doing. So.
And, you know, I'm thinking about some other possibilities. Like, for example, when there's a fallopian tube blockage, that's usually the tissues have kind of glommed onto each other inside the fallopian tubes, and they're stuck together. Now, by perhaps taking pressure off in the lower abdominal area, by stretching those muscles,
Yeah.
we might be able to open some of that and
Yeah.
perhaps open up those
Yeah, there's a lot of there's
so
the
or at
whole
least help to do that.
yeah, there's actually it's called Yamana for pregnancy, and there's an actual program where you use the balls, and when you get to a certain part of pregnancy, you can't roll in the front of your body, so it's mostly just on the side and your back.
Mm-hmm.
So it's really good I've known people that have taken there's two little balls and you put them behind your back and use them when you're in the delivery room.
Mm-hmm.
So yeah, this
Little back support there.
little back support. Yeah.
Perfect.
Yeah.
Great. How about fibromyalgia? How do you
Um,
break that down for us?
well, I get stuck on this because I know I've just started to encounter some people with it.
Uh-huh.
So it's really about, it's actually a study that came out, and I was on, I can't think of the name of it, but it was saying they just discovered the reason why it's being caused. It's something with the lack of, there's too much blood flow going to an area of the body. And it basically there's too much stimulation going there, and that's why it's causing all the flare-ups and all the
It's a theory.
yeah. But it's an article. I could go find it because one of my colleagues posted it, and I can't remember the name of it, but it was recent, and I thought it really just stunned me that people that have it, like I have a client who has fibromyalgia and her flare-ups have gone down. So if you can only roll for 30 minutes a day or less, or do a 30-minute session because the flare-ups are too bad or they're too much, then that's what you do. But I think that any condition, fibromyalgia, rheumatoid arthritis, any of these autoimmune or conditions you can work with, but it's just more gentle, and I don't mind. Like, it's just a more gentle way to do it with certain conditions. So
Yeah, fibromyalgia, you
Yeah.
need to be gentle.
no, you
for
really
sure.
do, and that's why I did a session with a client, and she's continued with it. She does it all the time. Her flare-ups have gone down, and she doesn't have them anymore.
Yeah, I think the neurological aspect you were talking about, the overstimulation,
Yeah.
that kind of thing. There's a couple of components, and this is why magnesium tends to be a good thing to use, because calcium really stimulates the synaptic action.
Yeah.
So calcium's overstimulating. If they've got maybe too much calcium and not enough magnesium, you bring up the magnesium and it balances it out.
That makes sense. I think I know someone that was taking magnesium or you have to take the vitamins. I take vitamins too. I'm gonna just take probiotics and general things. So, but yeah, there's certain you have to take certain vitamins just to kind of counteract and counterbalance. So.
And now if we make those vitamins some of the type of nutraceuticals that I'm using, that are extremely effective and very quick in response, they may see things changing right in that session.
Yeah, absolutely.
And that can help them to do that.
Yeah, absolutely.
So we have a lot of work to do. So
yeah, there's always more work to do in this field. It's ever changing, and I honestly see with the changes in healthcare and in massage and wellness that because yoga is already in hospitals. This is just a part of the process of rehabilitating and getting the body back to its natural order.
Yeah, there's a lot of work to do in terms of opening some minds and
it's okay.
and getting involved in some procedures that are already inherently
and people
in hospitals and so on.
People know, and people are aware of certain modalities, and they're aware of something. They just have to be exposed to it. Like I teach workshops throughout the Tampa area and make sure people are educated, and I put little snippets and articles and blogs so people have the information. So it's always an avenue to be educated. Just education. People just have to do it. People just have to come learn about it and have a session. Just take the risk of. No one's ever disappointed. I haven't met anyone that hasn't enjoyed the session or felt better after.
Excellent.
Yeah.
That's good. So, any more questions from the audience here? No? Okay. Let's take a short break. Okay. No? My producer's saying no here. No breaks. She's a slave driver.
If you need a break, we can take a break. It's
break.
currently with the YouTube. When
Oh.
we go to break, it just goes blank for a while. So until your producer gets that part taken care of, I am like terrified of breaks. But with that being said, when we come back,
yeah, when we come back, we'll delve into it a little bit more, talk
Okay.
some more about
Yeah.
some of the possible applications, and we'll see. It's a potpourri. I wanted to look at how we've got you linked up on the site.
I
So
know.
I
I
can
don't
mention
know.
that.
I usually use them. I swear the whole social media stuff is just garbage. I learned it.
For some reason, like you moved somewhere.
Oh.
Okay. You're on.
Okay. I guess we're back. Welcome back to Path to Wellness. And I'm sitting here. This is Dr. Christopher Jackson, PhD, DOM, Florida. And I'm sitting here with Emily Stein.
Hi.
Who has you have a bachelor's, right?
I have a bachelor's in sociology and anthropology.
Okay,
And
which
so-
is neat.
Yeah.
So
Yeah.
so if somebody breaks a bone, you try to figure out you do a carbon dating, not see how old they are.
No, I actually no. My education has actually really taught me to accept. I know for one thing to accept people regardless of what background they come from, and always work with people and come to the level, because that's what I've been raised. That everyone deserves the same treatment regardless of who they are or where they're raised or who they came from,
That's
and no
good.
one should be treated differently regardless of. And I really think with all this work is that it's wellness should be accessible to everyone, not just the rich and famous. And I think it's gonna come to a point where maybe it will be. And right now it's kind of at that point where it's not exactly accessible to everyone, but I think that it should.
Yeah.
So
Yeah, and there was a pretty good movement to get natural medicine more available, like including Medicaid and Medicare.
Yeah.
Just a few years ago, there was a bill that was in the works nationally. It was called HR 646. It was in the House of Representatives, and the idea was to get natural medicine covered by those programs, and it got shot down in Congress. So
I'm sure.
yeah, unfortunately. But there are other things coming up here, like
Yeah.
we have the potential for complementary alternative medicine, holistic medicine coverages. There are
Possible.
memberships. We've been incorporating some memberships some people are taking advantage of.
Yeah.
So there are more options now.
Which is
So, and one of the things that we're struggling to help people avoid that's so common in conventional medicine is the use of NSAIDs, right? Non-steroidal anti-inflammatory drugs that are causing strokes. They're causing, problems, gastrointestinal system problems, the stomach, the intestinal tract, liver, kidney damage, heart attacks. Many of these kinds of things are resulting from the use of NSAIDs, and people don't realize there are thousands of people who are hospitalized and dead after the use of NSAIDs over the counter every year in our hospitals. So it's not, a lot of people get the impression if it's over the counter, it must be okay. But there's an overuse going on there, and that's why we're seeing these people having these issues. So this is another approach that can help them with the pain, help them stimulate, hopefully, their own endogenous opiates and endorphins that help them feel better and help to actually physically change them at the same time.
Because it is possible that some people say that if they're doing this, like, am I going to get a workout? I'm like, well, you might sweat when you're releasing toxins. But if you want to get a workout, I do say you should go ride a bike or go for a nice jog or go for a walk. You can still get a sweat going for a fast walk in Florida.
For sure.
But I think that
You can get a sweat just walking outside.
you can get a
Especially
sweat
in the
walking
summer.
outside, especially in the summer. Yeah. But no, I think it's just
So we were talking during the break about the knees. And you were talking about, trying to prevent bone on bone. And I've had patients come into me and I've treated them with acupuncture and turned them around entirely. I mean, I had one gentleman who for years would just come in for a booster every once in a while. And he played softball and all these things. And his issue was he was actually shown to be bone on bone in one of his knees. And he was set up for knee surgery. And before that month of time that I had there to keep him from needing the knee surgery, he already canceled his appointment. And we went past that, and his knee just came totally around, and all the tissues regenerated and everything else. It was great. So there may be similar benefits from
Yeah,
the
absolutely.
body roll.
Yeah, I've had just between and I actually did a recertification. Every 2 years with Yamana we have to get recertified, and it was a whole thing with knees. And there's a lot of deep work we do with the lateral rotators, the piriformis, all the muscles in the hip, because things just get really sticky and they get tight and they don't always feel so good. So we work on opening up and creating space in those areas. So creating space, you're less likely to get hurt. So the knees, like think head, shoulders, knees, and toes, like it's all connected. So when you work on your feet, you work on the knees. So every person learns about how to use the foot wakers and for their knees, because everyone needs it, but everyone will benefit from it.
Why don't you describe these foot wakers you're calling them? So, so people know.
They're these porcupine. They're these mounds, and they're gold, and they have little like nubs on them. They're nubby, and they have these, and they're 2 mountains, but they're dome shaped, and you work on stretching them, but they're also good for your hands too, because you can do stretches for your hands and your wrists. So, and I do have like my website, and it has all the descriptions of all the different products in the store if someone wanted to buy them, and then they could set up a session with me to learn how to use them. So they all the products are listed on my website if people want more.
To do the session.
Yes, first.
Initially.
Yeah. Yes. But they're on there, so if people are curious of what they are, and they can Google Yamana foot wakers, and images will pop up. Yeah. But they're really a cool thing to use, and I use them while I'm cooking oatmeal. I'm in the kitchen. You can stand on them, and it's like a nice foot massage. So it's like reflexology for your feet.
That sounds good.
Yeah, it's like a foot massage. But you're using a tool, and it's.
And that would be wonderful for plantar fasciitis.
Yeah. Right,
and that's what we were talking about earlier.
Yeah, but I helped. I helped
to be able to do that.
Yeah, and the girl that actually was a runner who had really bad knee pain. I know that she's someone that I know she needs them, but everyone has a different time and needs them in a different place. So, but I know that every runner, any person who's an athletic individual, could benefit from having the foot wakers. Anyone who's on their feet all day, waitresses, dancers, people that are on their feet.
Oh yeah.
Yeah, because feet take a lot of impact. Yeah. And it feels amazing if you go out and you just go on them. It's like, oh my God, I'm stretching my foot and I'm getting it all I'm opening it up, and so yeah.
That's good.
Yep.
And you're doing more of those types of things.
Yeah.
So you mentioned your website. Go ahead and tell them.
My website is Roll for Fitness. It's www.rollforfitness.com, and my Facebook page is just facebook.com/same roll for fitness, ROLLFOR fitness.com, and then I'm on Instagram. It's just EMH Stein. So, and I post classes that I'm teaching and workshops just to keep people on the list of be aware of what I'm doing.
Yeah.
Yeah.
And so we have some things in the works at Path to Wellness.
Yeah, and I have definitely I'm the only person, the main Yamana practitioner in Tampa Bay, and I do happen to live over in Tampa, but I service Tampa, St. Petersburg, and Clearwater. So.
Yeah. And the location of our office is a pretty good one for that, I would assume.
Yeah, no, it is.
Right off the highway.
Yeah. So it's a good location. Yeah.
And if you want to learn more through our site, the site again is A Path to Wellness. It's aptw.net. That's www.aptw.net, short for A Path to Wellness. And under pain is where we have most of the discussion, because a lot of what you do is related to pain.
Yeah, it is.
And pain management.
Pain management.
Yeah. And it's not pain management with opiates, and it's not pain management that causes you to.
It's natural pain management.
It doesn't make you so addicted. You go out on the street and start buying it.
You'll become addicted to rolling. That is body rolling, not the other.
So you'll be buying balls on the street instead.
And instead of intoxicating your liver, you're actually cleaning and detoxing your liver at the same time.
And your whole body.
Because a lot of times when we want to help ourselves and not have that pain, we actually are killing ourselves in the other aspects with liver issues and everything else. That's just my little 2 cents.
Good speech.
Yeah.
That's right. So
I do have a YouTube channel which I'm putting things up.
Okay.
Like it's just EMH, and no, it's roll for fitness.
Mhm.
So it's ROLLFOR fitness. So I'm making videos and I put them up periodically on there.
Mhm.
So.
Okay. So, you know, we obviously, you know, my practice is about holistic medicine, natural approaches to treating everything that we can. Other than, you know, you're on death's door and you're in an emergency room. We're approaching everything holistically, and this is part of that, you know, working on basically your whole body while you're doing that. Yeah. So, very good.
Yeah.
And so we have this is Emily Stein we've been talking to. She's a Bachelor of Science in Sociology and Anthropology, right?
Bachelor of Arts.
Bachelor of Arts. Okay.
Not a BS.
Okay, we need to correct that.
Yeah, well,
Did we already discuss that?
Yeah.
Oh, okay. All right. I need to work on myself then. But she's a certified personal trainer, active isolated stretching educator, and treats a lot of these conditions we've been discussing and helps you with your overall well-being and health.
Yeah.
Right? So just another step on the path to wellness.
Yeah.
So thanks for listening to us. And we like putting out more approaches to wellness. That's we're a path to wellness, and that's what it's all about. So thanks for listening. We'll talk to you next time.